COVID-19 reporting in South Africa. One of the big advantages of doing these global journalism seminars online is that we've been able to get speakers, amazing speakers from all around the world. One of the big disadvantages of doing these global journalism seminars online is that internet connections and sound quality is hugely variable across the world, and it's something we have to deal with. So we're delighted Mia can join us, but we can't get her on Zoom. So she's on a speaker and she'll speak, but I have her presentation here, so I will present as well. If there's any issues, please type them into the chat box and we will respond accordingly. I wanted Mia Malan to speak to us today about COVID-19 reporting in South Africa. South Africa has had one of the most stringent lockdowns of any country in the world, one that really stretched public limits of tolerance and public debate, and happened in a country where COVID-19 could be lethal, in a country where very few people, a lot of people have very little access to healthcare, and in a continent, crucially, that is used to lethal pandemics and used to ongoing conversations about public health. Mia is one of the leading health journalists in the country. She's the editor-in-chief of Bhekisisa, a medical and health website. It was part of the Malan Guardian's health reporting team and has now been spun off to be a standalone site and has done some of the most important reporting in this area. Mia, welcome, and over to you.
Thank you very much, Mila. I am sorry that I haven't managed to get in, but I'm going to try my best over the speakerphone. So you can go to my first slide, which is just the subject of my, as you've mentioned, what I'm going to talk about. You can flip to the second one with a picture. I just want to tell everyone a little bit where I'm coming from and what Bhekisisa is, so that you have an idea from which perspective I'll be talking. That picture that you see there is our team. We're a small team, only 7 people. And if you're wondering what Bhekisisa means, it is a word in South Africa's biggest language, Zulu, and it means to scrutinize or to look closely. So if a Zulu patient goes to a doctor and want to be checked out really well, they will ask the doctor to Bhekisisa them, and because we look deeply into health issues, we called ourselves Bhekisisa. So we're a donor-funded media startup. We get most of our money from the Bill and Melinda Gates Foundation and from the Open Society Foundations. And we're really not the first stop of people in the mornings for health news. We aim to bring nuance and do health analysis and shape discussion. So we want to frame how people think about health policy issues. And as Mira has mentioned, we're 7 years old and we used to be based at a legacy publication. But about a year and a half ago, we went independent, and we have mainly an audience of decision makers, and we're a center, so we don't just report, we also host public discussion forums and media events, trainings, and we moderate events. So you can go to the next slide, Mira. Before I talk about COVID reporting, it would be helpful if I give you some background on COVID in South Africa. So if you look at that little map there, you will see that we have had about 750,000 confirmed cases in South Africa of COVID. We've got a population of 60 million people, so it's not too many cases, but we have very few active cases at the moment, only about 37,000. And are those people who have COVID at the moment. So it's the total number of cases minus the people who have died and minus the people who have recovered. And that is what we have, that we know of course, at the moment. Of those people, the 750,000, we've had about 20,000 deaths, which is not a very high death rate. But in South Africa, there's quite a bit of controversy around have we counted quite extensively. We've done 5 million tests, which is quite a high number for our population. And our pandemic started on March 5th, and our government acted quite quickly. Within 2.5 weeks after that, we had a national lockdown. And as Mira has mentioned, it was a very, very strict lockdown for at least 2 months. And then we still had a lockdown after that. But the first 2 months was the strictest form, and it was so strict that we were not allowed to buy alcohol. You couldn't buy alcohol. It was banned, sales of it in shops. Tobacco sales were banned. There was a huge curfew. There was police and military who patrolled the roads because to see that you didn't go out. Only essential workers could go to the office, and journalists were part of essential workers. But only those who went into the field went to the office. And then something about South Africa that is important to know, also when the media reports on it, is that there is massive inequality. So that means that parts of the country, poor people experience this epidemic very differently from wealthier people. They could, for instance, people in informal settlements couldn't possibly have social distance because they live many people in a small space. Many don't have access to running water. To give you an idea of the inequality, in South Africa, only 16% of our population can afford to buy health insurance. The rest of the population relies on a very, very dilapidated public health system. But if you look at the money we spend on health in South Africa, we spend about 8.5% of our GDP on health, but half of that goes to the 16% who have private health insurance, and the other half goes to the 84% that don't have health insurance and that relies on the public health system. So you could imagine the difference between the two systems. There's really two health systems in this country, the one with very, very, very under-resourced, the other one quite a good system. In terms of policies in South Africa, masks are mandatory in South Africa to wear with COVID. Everyone has to wear that or you will get taken on. And the other thing that is quite unique about us, if you were going to compare us, say, to European countries, is that there's been massive corruption with tenders for personal protective equipment, and that has happened against the background of other corruption, state capture. When we had our previous president, Jacob Zuma, there was a lot of corruption emerging, and now this has just come on top of that. You can go to the next slide. So this slide is about news media in South Africa. Those figures that I have there is probably a little bit old. It comes from our government website, so that's why I added pluses next to them. But I wanted to give you an idea of what type of media is in South Africa. So, you know, we've got the commercial radio stations, lots of community media, and we also have most foreign media organizations has a representative in South Africa. So in terms of television stations played a major role in COVID. We have three 24-hour news channels in the country. The one is from our public broadcaster. The other are two private stations on satellite TV, ENCA and News 24. And you would think that very few people in South Africa without inequality has access to it. But if you look at our national census of 2011, it found, and the follow-up one found that as well, that more people have TVs in their homes than fridges, actually. And you would very often find that people in poorer communities have satellites because it can be shared among many people and the cost can be shared. So those news channels are accessible, but still, radio is the most accessible medium in terms of media in South Africa. And you will see on the slide, we have 11 official languages in the country. So that means our public broadcaster needs to broadcast in 11 languages. And you could imagine what massive task that is when it comes to a pandemic like COVID-19, where you have to make sure that people get information in all those languages. And over the past, say, 5-6 years, startups have really expanded in South Africa. So when it comes to specialist health journalists, there are quite a few media startups with specialist journalists who can report. It's not just Bhekisisa. We have another agency called Health E. There is another donor-funded startup called Spotlight. And there's some of them that specialize in social justice, but they're headed up by people with a health background. So in terms of content that's available for free in the country to mainstream media organizations, there's quite a few media startups to choose from. And then lastly, media freedom is relatively good in South Africa. We can pretty much criticize criticize who we want. So during the disaster time, just like in other countries, there's a provision for if people spread false information that they can get a prison sentence. And that law has been misused in many countries in Africa to suppress media freedom, but in South Africa that hasn't happened. We've pretty much been able to criticize, but it has been used, for instance, for people who spread false media and social media. We had one man in South Africa early on in the epidemic who made a video, put it on social media, in which he claimed that all the COVID tests that we used were contaminated, and he was pretty quickly arrested and sent to court. So that law is pretty much used in a reasonable way in South Africa. You can go to the next slide, Mira. So in terms of the impact of COVID on the news media, as elsewhere in the world, there's been a devastating financial impact. There's been many job losses, more than 700. And in the first 2 months of lockdown, 2 large magazines closed down and 80 small publications. And yesterday, our public broadcaster, the South African Broadcasting Corporation, devastating day. All the employees received retrenchment letters, or some are going to be retrenched. I actually received them this morning, but it was announced yesterday that 400 out of the 300 employees of our public broadcaster will be retrenched. So there's a lot of anxiety, and if you look at social media, you'll see a lot of complaints about it. It's not entirely just COVID. They've had financial problems for a while, but because they were not able to recruit advertising when COVID hit South Africa in March, they have experienced a very, very harsh financial effect and now have to retrench people. You can go to the next slide, Mira. So instead of just telling you about South Africa's coverage in general, because there will be so many similarities with what has happened in the rest of the world, I thought I would concentrate on 3 aspects and that make South Africa's coverage unique and that I can tell you a little bit more about. So one of that is that what is the difference between the news media coverage of HIV and COVID in South Africa? Because we have lived through another pandemic, which is HIV. And what happened? Secondly, what were the consequences of turning journalists in the country into health journalists overnight? Did we see misinformation as a result of it? And lastly, how did it influence what we did at Bhekisisa? And did we learn any lessons from it that can be applied for the future? You can go to the next slide, Mira. So as I mentioned, this is not the first pandemic that we've lived through in our country. HIV is a massive epidemic in South Africa. We've got about living with HIV of a population of 60 million. And there's, of course, a difference between HIV and COVID, and that is that the one is a very slow pandemic, which is HIV, and COVID is a fast one. And COVID affected anyone and everyone in the country, where HIV affected certain parts of the population far more than others. And if you lived in a poorer area in South Africa, you are far more affected, but likely to be HIV positive because you've got less access to health services and to information, and you're likely to be disempowered when it comes to relationships, especially if you're a woman, to be able to negotiate for safe sex. So you are obviously more affected, and that means that not everyone journalists reported on HIV because it didn't, everyone wasn't as interested in it as COVID because they didn't feel equally threatened by it. But the main thing that influenced how the media reported on COVID in South Africa is how the government responded in different ways. So for those of you who have followed South Africa a little bit, when our epidemic was at its we had a president, Mbeki of the country, who doubted the cause of AIDS. He did not believe HIV caused AIDS, and it caused that in South Africa, the result was that there was a lot of quack remedies being promoted. We had a health minister who supported him. He promoted beetroot and garlic as remedies for HIV. But the most devastating part of it was that for a very very long time in South Africa, we didn't have access to evidence-based medicine in the form of antiretroviral treatment. Many, many people died unnecessarily. But because of this, the kind of coverage that you saw during HIV was mostly political. It was political reporters reporting on whether you agree or disagree with the president. And because our country comes from such a racially divided history, and our president at the time, Thabo Mbeki, played a very important role in fighting for freedom for the country, it was very often seen that if you disagreed with him about his misunderstanding of science of HIV, it was seen as a lack of solidarity, because politically it was seen as if you didn't support the president, you didn't respect what he did for the country. So as a result of that, there was a lot of he said, she said coverage with HIV that didn't really concentrate on how treatment worked, or what what are the things that people could use to get better, but rather on something going back in time that had already been proven. Is HIV the cause of AIDS or not? And you can compare it a little bit with, if you think of Donald Trump in the US at the moment, there's a lot of reporting also in the US about funny, what did Donald Trump say now? But it was the same in South Africa. What's the next thing that the health minister is going to say? Is it going to be lemons after garlic or after beetroot that she's going to promote? That sort of thing. So there wasn't in-depth reporting on the actual HIV research that happened, and that was left to health reporters. Political reporters didn't see it as their job to do that. And of course, all journalists didn't report on HIV, but in South Africa, as in the rest of the world, every single journalist reported on COVID for the past 3-4 months. Otherwise, you really had nothing to do. And when it came to resources, where COVID devastated organizations financially, they still had more resources to report on the pandemic than with HIV, because they used all their journalists to report on it. Where with HIV, it was 1 or 2 people reporting on it. You can go to the next slide, Mira, the one that says HIV, COVID and politics.
Yep, we're there.
So one big difference between HIV and COVID reporting that the media did is HIV turned scientists in South Africa into activists. If you look at that picture on that slide, that guy who is there in a white coat is a world-renowned HIV researcher called Salim Abdul Karim. He's South Africa's Anthony Fauci, basically. And there he is in the year 2000, HIV researcher busy protesting against the health minister who didn't want to give pregnant women access to drugs that could prevent their babies from getting HIV. That very same Salim Abdul Karim, the government wanted nothing to do with him. He had to protest against him in the year 2000 at that AIDS conference. He was made the chairperson of the government's Ministerial Advisory Committee on COVID-19 in South Africa, and literally became a household name. He has a very special gift to explain science in a way that people understand it. He was used on national television to explain to South Africans, to the nation, where we're at with COVID, what's going to happen, why are we having a lockdown, which science is being used. And Salim Abdul Karim is known for his HIV research. He wasn't known for COVID research because, there wasn't a lot of COVID research when he became the ministerial chairperson. But journalists, health journalists knew who he was, but the average journalist had no idea who Salim Abdul Karim was. With COVID, with the way that he was accepted now by the government and used as someone to explain and break down science, he became a household name in the sense that You magazine, which you can equate to, say, People's Magazine in the US, it's like a TV magazine, would do stories about him and his whole family, and not about COVID, about, how did you become such a scientist, but ironically, he's been around for a very long time. So where only health journalists would have interviewed him during HIV, now everyone was going to interview him. And during HIV, it would have been about why is the government wrong, and now in COVID, it would be what is the government doing. But that is not mean that there wasn't politics with COVID in South Africa, because some scientists felt unheard. They felt that they're also on a ministerial advisory committee, but their opinions are not heard. And they had very, very robust arguments about science, because we know COVID science is new and it changes all the time. So there were lots of arguments about, did we have the right testing strategy or the right lockdown strategy, and did it really work? And if they felt their voices weren't heard, they used the media to make it heard. So some of these scientists who felt unheard formed a group called the Scientist Collective, and they released in a very influential publication in South Africa called the Daily Maverick, 2-weekly, 3-weekly explanations on what they think should happen scientifically in the country. Sort of, should there be another lockdown or not? How should we be testing? If you go on holiday, what should you do to protect yourself? And the media gave such scientists space, where during HIV, some publications also gave the HIV denialist space, but that was very, very dangerous to do, and it was seen as the wrong thing. But yeah, it was a healthy scientific debate. It was all based on actual science, but just different interpretations of it. It wasn't about denying science. You can go to the next slide, Nura.
Okay.
So what happens when journalists become health reporters overnight? In South Africa, that had quite a few implications, because the South African media mostly don't have health editors. So there might be a junior health reporter at a publication, but it's generally not someone who's very influential, who can sort of take on a political reporter or political editor and say, no, this is wrong. And because science and math education at school in South Africa is pretty bad, and very few students take science and math in high school, it means the average journalist is not that well versed in science and math. And COVID research on top of that is fast-tracked, as we've seen. So we see lots of research that's published that wasn't peer-reviewed, and that often turned out to not be accurate, and it obviously makes it very hard for journalists who don't have a science and a background to interpret that research and report it on it correctly. And on top of that, because COVID was the only news story for 3-4 months, there was a lot of airtime and space to fill, so there were more opportunities for mistakes, because there were so many stories and that had to be done. You can go to the next slide, Mira. Okay. So to give you an idea of the type of challenges, the picture on there, the woman you see there, her name is Firo Haffiji. She's a very, very well-known journalist in South Africa. She was the editor of the Malan and also of a big, large South African Sunday newspaper, the City Press. And she's now with the Daily Maverick, and she's known as a political and investigative journalist, and a really good one. And she, with COVID, started to report on COVID throughout the pandemic. And she was part of a webinar where she spoke about the challenges that she has experienced. And she says one of the things, because she was, because she didn't have a background in it, she confused what was a physician and a surgeon at some stage. She thought it was the same thing. She struggled to understand the difference between bacterial and viral infections. So COVID, the new coronavirus, is obviously a virus and not a bacterium, and it gets treated in very different ways medically. And when Russia announced its vaccine, as you will recall, the vaccine had not been tested in large-scale trials. Many of her and her colleagues initially thought that this is a breakthrough, because they felt they didn't have exposure to research designs and processes. But Firo has now decided to be a full-time health journalist. She says, I thought health was a soft beat, but I've learned it's literally about life and death, and investigations need to be process-driven rather than conventional investigative reporting that is often event-driven, and that screaming headlines don't work. So in a way, COVID has allowed political and investigative journalists in the country to explore health issues and realize that it can be a pretty important and a tough beat, and it doesn't have to be the thing that the junior reporter in the corner does. You can go to the next slide, Amira. But here's an example of what has happened because so many people had to report on this overnight. Some of you may recall that in May, there was a study in France that was released that claimed that smoking protects you against developing serious COVID-19. Now, that study that was released was, first of all, not peer-reviewed. It was what they call a preprint, so you publish it before a panel of experts have reviewed it. And it was an observational study, which means that it's not a study that can prove the link between cause and effect. It's really just talking about association. And what they basically did was the researchers went to a hospital in France and went to the COVID ward and asked the people in this COVID ward, do you smoke or don't you smoke? And then derived from that, because many people who were sick said they were smoking, that smoking was a protective factor. But there's a lot of bias that you can find in a study like that, because first of all, if you're a smoker and you are in a hospital ward where you feel your smoking could potentially be responsible for it, and the researcher asks you, do you smoke or don't you smoke, you can be very likely to just not tell the researcher that you smoke because you might feel guilty about the money that's spent on you and that maybe you could have done something that could have helped and led to your COVID. So there was a lot of bias in that study. It couldn't prove cause and effect, but in South Africa, that study exploded because we, of course, had to back a ban on tobacco sale products about what people really weren't happy about, and the science was not that clear whether you needed to do that or not. So editors, well-known editors, started to tweet the study results in South Africa saying, yeah, we can show our minister who implemented the ban that clearly you don't need a ban because smoking will actually help you not to get COVID. And as a result, it encouraged people to smoke. And we all know that from many, many studies that have been done, that smoking is one of the most common causes of lung cancer and respiratory diseases. So that had a very devastating health impact. And result of journalists not understanding that study really did not prove cause and effect. It had a very small sample and that there was a lot of bias in it. The next slide, Mira. Then I'm sure all of you know about Donald Trump, who promoted hydroxychloroquine, who he claimed could prevent you from developing serious COVID. And some studies initially being able to prevent you from dying from COVID or from developing very serious symptoms. Those studies were not studies that could prove a cause and effect and all turned out to not be confirmed and not be right. But in our country, those studies initially were reported by journalists who didn't have a very good understanding of the study design. In our country showed that medical professionals actually get a lot of their COVID information from the media. And as a result, doctors started to prescribe chloroquine to patients. And chloroquine is used widely in South Africa by patients who have lupus and arthritis. And as a result, our chemists ran out of chloroquine. The lupus patients and the patients couldn't get hold of their medication because it was all prescribed to patients for whom it wouldn't work. And that is an example of the devastating consequences that such reporting can have. The story on the right hand that you see is a story that we then produced to explain why it doesn't work. And on top of that, we produced a 2-minute video, especially for doctors, to explain why chloroquine, why studies show that it's not working yet. The next slide, Mira. So how will COVID shape the future of journalism in South Africa? These are just a few small things that I think it will have an influence on. If you look at that at the right-hand side of that report, you'll see it says additional reporting by Bhekisisa, and a little bit lower down it says Spotlight recently reported. That is a story that was published yesterday on the largest news website in Africa. It's called News24, and it's one of our publication partners as well. And they published a story about the latest COVID vaccines from Pfizer and from Moderna. Now, it's one thing to write pharmaceutical companies, it's quite another to understand the cold chain systems that will be required for those vaccines, and also to understand the distribution systems. You'll see there at the bottom when Spotlight recently reported that they reported on Covet, which is a mechanism for procurement and equitable distribution, and it can be quite complex to understand the rules of how COVAX will operate. Now, that is an example of News 24 used the press releases and reported on, the vaccines that will be available now, but now used two media startups to deepen that reporting. And this you did not see as commonly before COVID at all. So something that COVID created is a larger space for specialist health media organizations to have their reports be used in the mainstream media, and that's definitely happening far more regularly now, and it helps to create more in-depth reporting and nuanced reporting. The other thing that I think it has done is that it's created long-lasting relationships between media houses and health media startups. To give you an example, one of our partners at Bhekisisa was to have a daily slot with COVID on News from Africa, which is one of the 24-hour channels that report on news, because they recognize that they don't have science reporters, and they wanted us to speak about our stories or explain a COVID issue each day. But we didn't have a television audience, so we gained as much from it. And as a result of this daily slot, we have now developed a strong enough relationship with them to start a weekly 30-minute health program with them next year on the television station, and not about COVID, about general health issues. So it's helped us to mainstream health on a national television station. COVID created that opportunity. I don't think we would have had this relationship if it wasn't for this pandemic. And then the other thing is that we presented a course for Africa journalists, about 70 of them. Feral Hafiji that I spoke about was also on that course, that explained epidemiology to journalists from around Africa. Now, of course, it wasn't Bhekisisa who explained the epidemiology, it was epidemiologists who explained it, we just hosted it. But the interesting thing that we learned from that is that, political and business journalists and news editors, if you ask them a year ago to attend a science course or epidemiology course, they would generally tell you they don't have the time. But COVID created an appetite for that type of thing, because it was knowledge that journalists required, and they would otherwise never have attended something like this. So COVID definitely created opportunities for this, and if you then have that knowledge, you can use it after this. You can use it to report on climate change and the consequences of it, or on other diseases. And lastly, webinars is really something that I think will stay in South Africa and probably around the world. At Bhekisisa, we did a lot of public discussion forums as well, but it's such a big thing to organize an in-person event. And all of a sudden, it was cheaper to do, it was quicker to do, and as Mira has mentioned at the beginning, you can all of a sudden access a much wider audience from across the world, and journalists have better and easier access to experts because of webinars. So that's something that I think the South African media will definitely carry forward. The next slide, Mira. What did we do differently? So our audience tripled, just pretty much like, it happened to the rest of the media as well. It wasn't just us. But because we all of a sudden had a much broader audience than just decision makers, we had to adjust a little bit what we did. So we did more explanatory journalism. We did a little bit more listicles, and we made more videos to explain things. So we would, for instance, make a video, as I've mentioned, on why chloroquine not work to treat COVID-19, or we would make a video on, how does an antibody test work? What can it do and what can't it do? And we started to produce the same story in different formats. So that chloroquine example that you saw, we will have a in-depth, say, print story, and then we'll just take a small part of it and make a video. And we started to produce 1-minute podcast, something we never did before. But when Salim Abdul Karim explained something in an easily understandable way, we would take that and, just take that clip, that minute clip, and put pictures over it, or put subtitles on what he said, so that we could distribute to people important information, but still pretty much in the style that we would normally do. Didn't try and break news. We just tried to deepen people's understanding of issues in a different format. And because we don't do news, but there was so many government press releases because we had so many different levels of lockdown, we started to live tweet all of those press conferences because we didn't want to change our style. We didn't want to change what we do. We're not news people, but there was a need for that information. So we did a lot of live tweeting. We would put a link to the press conference on our website and then live tweet. And something that was a great thing that COVID necessitated for us to do, but that we now benefit from, is we created a resource section on our website. So if there were new lockdown rules, we would explain and summarize those rules. It wasn't written like a story. It was a bullet point sort of form, and that we wouldn't share with another publication partner, and it meant it's drawing a lot of traffic directly to our website, and we're now continuing with that in the form of, other health issues. And the other thing that really changed for us is that we partnered with other organizations. I think it's very important to remember who you are, especially if you have a niche audience, and remember why they come to you, and not to try and duplicate what other organizations do or do things that you can't do. It's better to give them a space to do that, with you. So on the right-hand side, you'll see lots of graphs and stuff. That is a partnership that we formed with another media startup here in South Africa who specializes in data journalism, and they created a COVID dashboard that became very, very essential. The Ministerial Advisory Committee would use it, when they make their presentations, and would be quoted by academics. That takes the daily figures that the government announces and turn it into something meaningful and look at trends in the country. And we gave this media startup, Media Hack, a bit of funding for it. We gave them an audience and access to contacts, but we didn't try and create those graphs ourselves because we definitely don't have the skills for that. But it was a wonderful opportunity for a partnership, and we also could become more diverse. We partnered with a community media organization who had access to very different experiences of COVID in a very large township in Cape Town. And that meant that we could get the grassroots voices of people in Khayelitsha, in this township, and put them on national television because News from Africa rebroadcast those things because we had our daily slot. And it meant we couldn't travel. We couldn't get there because we weren't allowed to travel. It meant that we could give the voiceless basically a voice. Because of this partnership, without having to, we would never have been able to do it without partnering with an organization like that, and those voices were very important. The next slide, Mira. So in terms of challenges, donor-funded organizations mostly didn't experience a negative financial impact. It's pretty much a philanthropic heaven, COVID-19. That sounds very ironic, but there's a lot of things for philanthropists to fund. So we got actually more funding than normally. But what was a big challenge for us is we had 3 new staff members who started with us in February, and in March we went in lockdown. So it was very, very hard for me as an editor to know if someone is happy or unhappy because I didn't know them that well. I'd only known them for a month, and now we worked from home for 6 months. Now I have to deal with it virtually. That was a challenge. We also had one staff member who left us, and they got replaced because, how would you find a person and how would you mentor them virtually? And lastly, we worked from home for 6 months. We didn't go out on stories at all. And because we do a lot of long-form narrative journalism, and there were very traumatic issues during lockdown, it meant that there were mental health implications for reporters. So one of our reporters did a story on the increase of gender-based violence and was very traumatized after the interview that she had to conduct a 4-hour interview with a woman on the phone. But because she didn't see the woman in person, she didn't realize what had upset her so much because, all of it was over the phone. It didn't affect her so immediately. So she then had to go for therapy afterwards to figure out, she just knew that she was feeling bad, but couldn't figure out what was it. And we then figured out that it is because you don't see the horrendousness of that interview right in front of you. We don't see someone crying in front of you, and it takes longer to process it, and that it's very, very important to look at the mental health implications and address them. The last slide, Mila. 3 lessons that we've learned from COVID, or that I've learned, is that if you're an organization, stick to your mission and what you do best. It's always better to stick to your niche. Don't try, because it's a pandemic, to do everything. Never forget what your audience wants from you. Rather, partner with people to do the other things. And in Bhekisisa's case, we needed to remember that we are not the news agency. We're not the first news stop in the morning. We're there to bring nuance. And that is our purpose, and we should stick to that in the pandemic. Then secondly, that partnerships can really, really make journalism more powerful, but don't underestimate how much time it takes to manage those partnerships. I certainly definitely underestimated that. A window period for science training of journalists. So we're going to do a second course that's similar to the epidemiology one that we did in June and August this year. But I don't think journalists will attend the epidemiology one. I think we will have to adjust the subject. So we're going to focus on vaccines, because that's the next big thing that's now going to be news for a very long time. And lastly, we need to prepare for the next pandemic. It's probably not that far away. Thank you very much.
Mila, thank you. Thank you very much, Mia, for that, and thank you everyone for bearing with us through this through this slightly unusual format. But I hope you did get to hear Mia's excellent points, and we will send the slides and the summary round later. Mia, I think it's doesn't say much for the state of politics in Britain and the US and several countries that I feel we're having the debate about vaccines that you had over COVID-19, that you had over HIV, which is leading politicians essentially denying the fundamental truths of the crisis we're facing. What advice would you give in that sense to journalists in these countries in how to handle this kind of misinformation really that comes from the very, very top?
So, Mira, during HIV in South Africa, a very, very interesting relationship started to develop between scientists and journalists because of the denialism, that you can equate to people denying, that whether vaccines work or not, or whether there is a pandemic. And the reason really is because the scientists became more human, because they were so incredibly frustrated with the government basically not wanting to recognize their expertise and not wanting to do what we know would work essentially. So in South Africa, what helped journalists to report during that time was activists really, it created a space for activists, and activists became like the sort of like a link between scientists and journalists, until the scientists became activists themselves. So my advice would be to develop strong relationships with scientists. I think scientists during a time like this in South Africa and HIV, it showed us they were far more open to relationships with journalists, and they saw the media as far more as an ally than they would have if there wasn't resistance from government. So I think it's possible in your country that a similar situation could develop. And also you've had a previous situation in the UK, right, with the MMR vaccine, where it became a political issue. And I think there are things that we can learn from anti-vaxxers. They are excellent with media, and they're excellent with creating websites around their false information, but very, very good websites, and they're very good on social media. And we should, scientists should learn from those strategies, the scientists with the right information, and also develop those sort of things themselves, because that will help the media to access information better. But ultimately, it all depends on how much access you have to the scientists to defy that information. And the stronger your relationship, the more access you're going to have.
Thank you. If you do have questions, do type them in. We've got time for one or two. I just have one more question about health reporting. And you talked about the need for a lot of general reporters to be health reporters and how there's been very few health reporters in several big news desks. Do you think this is going to change permanently? Do you think we'll see the health beat gaining in importance and prestige going forward?
Mira, I'm not sure that we will see more health reporters because of the financial effects, the negative impact on media houses because of COVID, and it will be there for a while. And we all know that specialist reporters are more expensive than general reporters. But what I do think will happen is because there's a space for philanthropy and for media to be funded, I think there will be more health reporters from media startups whose copy will be used at larger media organizations, because that copy is normally provided for free to the larger media organizations. So I think the space for health reporting will grow and will be permanently opened. But I don't think larger media organizations are necessarily going to be able to afford to pay for health reporters. The more sustainable solution for that would be for donors to go into media houses and say, I'll pay the salary of a health reporter. That way, they will definitely, that they will have specialists. And that has been done in South Africa. 10 decades ago, the public broadcaster had a sponsored health reporter by an American philanthropy organization. That's one way to look at it. Or to use media startups where they are specialists and they work in an environment where there's a lot of specialists and can ask each other, can learn from each other.
Thank you. And my last question, which is a topic I'm looking at the moment, have you found that your audiences have changed in terms of their gender balance? Because health has traditionally been a topic that's both covered by women and also often consumed by women. And I was wondering if you've seen men coming to this topic as well.
That's a very interesting question. I have not obviously measured it scientifically to be able to give you numbers, but I do check the sign-ups to our newsletter every day. And I have certainly seen more men signing up. That is definitely an interesting trend. Because generally, health issues, especially in an emerging economy like South Africa, would very often focus on women's health issues, such as sexual and reproductive issues. And here we had an issue that focused on absolutely everyone. And I've definitely, the two things that I can measure it by is who signs up to our newsletter, because I can see the gender of people, and who retweets us. And I've definitely seen more male participation in both the social media and our newsletter.
That's really interesting. And final question from the audience, which I wanted to ask as well about, we talk about health reporting, but also about the importance of journalists in holding power to account. And it's important to kind of do these two things simultaneously, give up accurate information, but also keep an eye on the government, which you do very well. And the question is, you said at the beginning that you can question or call out almost anyone in South Africa. Who can you not question, or who do you feel you can't question or call out right now?
They're silent because I'm trying to think, who can I not call out? You can call out the president in South Africa, very much. You can call out opposition parties. So I think you can pretty much call out anyone, but there will be different consequences for different things. So one example in South Africa is, for instance, we've got a opposition party, the Economic Freedom Fighters in South Africa, which plays a very important role to give us, people who don't have a voice. But there have been journalists who've spoken out about leaders, and particularly women have been, really harassed on social media, and attacked, almost like sexually harassed, with rape threats, and there's been court cases around this. So it's not that you can't do it, but you would likely face a certain level of abuse if you take certain parts of society on. So you can do it, but there will be consequences, but you won't be legally stopped to do it. You won't lose your job because of it.
Yeah, no, absolutely right. There are different ways to silence journalists, and that's certainly one of them, and one of the most effective ways at the moment, sadly. We're running out of time, Mia, but thank you so much for your contribution and for braving the internet and the connections across continents to join us today. It's been an utterly fascinating, eye-opening discussion, one that's really needed to have. We're really grateful you joined us. Thank you. Next week.
Thank you very much, Ravi.
Thank you, Mia. And next week we have Isin Akabu speaking about her experience as the online editor of The Voice, which is the UK's only Afro-Caribbean newspaper. She'll be speaking with us on 25th November at 1 o'clock, same as this week, and do register to sign up via our link on our website. Thank you very much all, and thank you for joining. See you next week.